Hey, this is Steve Bell and welcome to the MedTech Mavericks podcast. Today I'm going to spend a little bit of time to talk about one of the systems that's out there that some of you know, some of you may know, some of you may have heard of, but a lot of people do ask me about this system and ask what I know about it because it's getting a lot of good press at the minute. Today I'm going to talk about Virtual Incision, and later in the podcast I do have Piet from Virtual Incision who's actually going to be on the podcast, and he's going to give us his thoughts, insights, and more importantly an update of what they've all been doing over at Virtual Incision, which has been incredibly busy. But before we get to that, what I wanted to do is I wanted to take you through the system first, so that those that do know it, you can get a refresher on it, and those that don't know it can get a deeper dive into it. But what I want to say first is, before we get into the system, is I do believe that we're going towards this segmentation. We've had Da Vinci for a long time, and Da Vinci has been sort of the gold standard and the standard that everyone looks at. But as we look at different procedures and different locations and different types of users, what we start to see is that there's going to be a segmentation of the marketplace, and there'll be certain specialized robots that will be very good at what they do. And Da Vinci is very good at what it does, but maybe something like a small ASC with a very small procedure or something, it's not the ideal robot to do that. So what you're going to see is you're going to start seeing more and more robots coming that have sort of like a super specialist area. And one of those that I'm intrigued on is Virtual Incision and their MIRA system. So let me dive straight into this, and bear with me as I do my usual stuff. What I'm going to do is I'm going to walk you through, first of all, their keynote speech, because I think it gives some very good information, and I'll pause it as we go. And what I'd like to do is just give you my thoughts and opinions as we go through this, and then we'll pass over to Pete, and then we'll drop back in again, and I'll give you some more final conclusions on that. So let's jump in on their keynote video. Nice location. Got nice headquarters, by the way.
Hello everyone, and welcome to Virtual Incision headquarters here in sunny Lincoln, Nebraska. After over a decade of dedicated focus, today marks the starting line of a new category within minimally invasive soft tissue robotic surgery. The category is called miniature, and on behalf of the team, we're excited to share it with you. Our mission at Virtual Incision is to make every operating room robot ready.
Right, I'm going to pause it there for a second. So, as John says there, it's about miniature. And one of the most impressive things that you're going to see about the MIRA system from Virtual Incision is just how small it is. And we'll get into a little bit about the size of it in terms of the diameter of the actual device itself and some of the issues around that people do raise with me quite often. But what I think is most important is what you're going to see and look out for in this video is that it's going to have the actual robot itself, the bedside unit, has no footprint on the floor. It's got a zero footprint on the floor. And that is something that's quite unique for MIRA, and that makes it very different than something like a Da Vinci SP. Makes it different from something like Vicarious Surgical. So I want you to keep that in mind as we do this. And then the second piece that John said there was that every OR will be robot ready. This is going to be really important because you're not going to have dedicated ORs for MIRA. You're going to bring MIRA, this type of robot, to the patient as and when they need them. So let's carry on with the video.
That means for the 90+% of ORs around the world that do not have access to this technology, we're looking to unlock those possibilities with miniature RAS. We're bringing the excellence of robotic precision, control, and visualization to surgeons everywhere, and thus minimally invasive surgery to so many more patients. To reveal this new category and introduce the world's first miniature robotic-assisted system, let's hand it over to my outstanding co-founder and CTO colleague, Shane Farrater.
Well, before we go to Shane, one of the things that I do want to say about this is that I want to give congratulations to the marketing department on this. This is a very Apple-esque video, and it feels very Apple-esque and very keynote made in the Apple style. And I love that because I'm a marketing freak, and I just love marketing. And this is a good bit of marketing. So yeah, well done, team.
MIRA is the world's first miniaturized robotic surgical system. My co-founder, Dr. Dmitry Lenikov, and I thought about robotic surgery in new ways. 20 years later, after plenty of design iterations, we developed MIRA.
Now, 20 years later, I can't repeat enough to everybody that this is a long-haul process. This is a decades-long process to get robots to where they need to be, and to get them from being what is sometimes referred to as a minimal viable product to becoming a fully commercial system. There's a big difference and a big gulf between those things. So again, huge amount of work that's gone into this, and you'll see it's a really clever system. But I just want to point out that even these guys that are now coming to the market now, it's a 20-year journey. You've got to get that in your heads.
MIRA is fundamentally different in its approach to surgical robotics. It uses miniaturized motors inside the patient rather than large motors on the outside. This type of technology provides a highly efficient, incredibly compact, and capable system. 14 motors inside MIRA power the articulation and create new techniques and new approaches to surgery. The first ever robotic flexible tip camera gives the surgeon a 70-degree cone for visualizing the surgical field. We look forward to giving you a hands-on demonstration so you can be part of the miniature RAS journey. Now let's go meet with Jay and take a closer look at what's under the hood.
Because MIRA's direct drive architecture is actuated completely from within inside the robot, we had to design some of the smallest motion control electronics that have ever been put in a medical device. MIRA uses cutting-edge brushless motors that provide amazing performance and best-in-class levels of reliability. Traditional endoscopes couldn't triangulate to where MIRA can reach, so we had to build our own.
So again, this is a very interesting thing. And many of these robots that are coming out will have bolted-on systems, like say a Storz system that's bolted on. But there's also a lot of them where standard laparoscopic systems, vision systems, imaging systems, laparoscopes, don't work for these systems anymore. If you look at the SP, that's also got an articulating sort of snaking camera. But what you've also got though is you've got a lot of other companies out there like Virtual Incision that are having to do this themselves. And I know that might seem like a throwaway comment, but when you're trying to build a robot and you're trying to miniaturize these motors, miniaturize the electronics, because there's a lot of control electronics for the control software of the motors, and you're trying to also build an imaging system, these things are really, really hard. Well done to Virtual Incision.
One of the world's smallest full HD image sensors and paired it with a modern GPU-accelerated image processing pipeline to provide high fidelity to the surgeon with seamless control that only our deeply integrated approach to product design can achieve. We know how important data is for today's workflows, so we built our console from the ground up to capture more than 30,000 data points per second, which we hope to be able to bring to users in the future. All this technology comes together using high-performance materials and manufacturing techniques, so MIRA can stand up to the rigors of everyday surgery and sterilization. Plus, we made it all fit in a surgical tray. For more on why that's important, we kick it over to Crystal.
So again, this is nothing like a Da Vinci, right? You've got to start looking at robots. Robots is such a wide catch-all term, and you have to start looking at the different form factors and the different philosophies and strategies that different robots have. And if you look, you can put the MIRA into a tray, which means the whole thing comes sterile. So this is about workflow and convenience. When they say robot ready, NEOR, it really is about the fact that you rip the tray open and you pull the robot out and you start using it. There is no draping or anything like that. So that is quite an interesting concept move versus virtually anything else that's out there.
Miniature RAS means it comes out of a surgical tray. MIRA was designed to be usable in any operating room, on any standard surgical table. The integrated MIRA surgical system does not need draping, making it approachable to a wide range of OR staff backgrounds. And all of its disposables can fit in the palm of your hands, leaving you with minimal carbon footprint. This means that MIRA is substantially smaller than any other mainframe systems on the
Yeah. So are you looking at that? That's the whole robot. So the equivalent of what you'd have with the bedside boom, the giant drive system, and everything for the SP, that entire thing is being held in her hands there. That is, it's a pretty different way of thinking about it. So yeah, quite interesting.
market. So just imagine what that could mean for the different sites of care. And that's our vision: robotic-assisted surgery anywhere, anytime, and for any patient. And while we're excited about introducing the miniature RAS category, we're equally excited about where we're going next.
I do want to make a comment, because a lot of people watching this will say, yeah, but that thing's massive. You seriously put that through an incision, like 4 centimeters through an incision? I think you have to listen a little bit later to what Piet's got to say. And yeah, it is big. It wouldn't be a standard trocar, and people will be concerned about things like port site herniation and things like that. But you have to think about that this is a stepwise fashion of the way that they go forward. And it took me a while to get my head around it. But once they explained it to me, I said, okay, now I get that. So, for example, if it's used in a colorectal case where you're going to bring the bowel out through a large incision, well, you put the MIRA through that same incision, so the incision size doesn't matter so much. But there's things that they're working on, and I think you'll get some surprises later on. But it's something that a lot of people do pick up on virtual incision.
All right, Piet, it's all ready for you.
Thank you, Crystal. With our successful submission, MIRA now becomes the first robotic-assisted surgical device to obtain market authorization through the de novo pathway for the use in colectomy procedures. And that makes it a trailblazer in soft tissue robotics. To get here, over the last few years, our clinical teams and our engineering teams have been very hard at work. And for our final submission, we provided the FDA with a comprehensive data packet to support this request. Now, we're very proud of the data we collected. It demonstrates that MIRA is capable of one of the most complex procedures. It's multi-quadrant, intra-abdominal procedures, and while we're incredibly proud of this accomplishment, we're just getting started. In the coming months, we'll be working very hard towards an international benign gynecology clinical study, and we'll continue to work hard also on developing new platforms that meet accepted standards of care for general surgery, but also for many other specialties. No doubt, it's a very exciting time for us at Virtual Incision to start this journey in miniature robotic-assisted surgery. And with that, I hand it back to John to close us out.
So before we close out with John on this video, I think it's important what Piet's saying there, which is that this is a journey. They know it's a journey. And again, I'm going to stress again, these are 20-year journeys to get there. And they've got the sort of the first product on the market, but there's a lot of things that they're working on that are going to come. And again, people are going to ask, where's the advanced energy? Where's extra instruments, etc. All of these systems are going to take time to come on. And Piet will explain that a bit later in the conversation I had with him today.
So this is not just a product launch. We think it's a watershed moment in surgery. That's why we're now going to work with some of the most talented and innovative surgeons to be part of the journey with us. The potential with MIRA is to help bring miniaturized robotic-assisted surgery to those operating rooms without access today. And we'll continue to innovate our technology, procedure indications, and devices to reach more patients. Our mission is making every operating room robot-ready. That's why the future is mini, and it's going to be huge.
Very nice video. Well done to the team there. Well done to the marketing team on that. I think that's really, really nice. Now some of you will have heard that, by the way, that and again, you can go and look at this online. Go onto YouTube and see it. You can go. I think there's some even from their site, and we'll dig into the site in a minute on this. But they actually took this onto the space station, which was really cool, and did remote operating on the space station. So they are committed to doing remote telesurgery, absolutely, as part of the walkout of MIRA and Virtual Incision. And if you can do it from here to the space station, that's quite interesting as well. So hopefully you've seen a little bit that this is a very different system, very different ethos to Intuitive. There are still questions about it, and it is a development program, as I say, and I've sat on it and I've used it, and a couple of things that jumped out. One was the size that people automatically say, and it's a very valid point. The other thing is about whether you've got 2D versus 3D vision is another one, because if you're getting such a small sensor down into that image system, then as someone who's done a lot of laparoscopic training in the past, I had no problem with the 2D, so that wasn't a big problem for me. But they probably are going to work on a 3D sensor in there somewhere, but they didn't let me know that if they are or not. The other thing that I think was really interesting about this was that I had my doubts on how strong those small arms could be, because I'm used to where these arms work through cable-driven mechanisms, and basically you have the motors at a long distance, and then you bring cables down to the end effectors to try and move everything with the end effectors, and you end up with limitations on how much strength you've got in there. Their strategy, which has been, in the arm, this is why the arms are a little bit thicker, the actual arms, is to actually embed the motors, the Maxon motors, into the arms. And that actually changes the amount of strength that you get in those arms. And I was super impressed. They got me to try and hold it and try and stop the arm from moving, and it literally couldn't. So that's another thing that people are going to ask. And if you talk to the guys at Virtual Incision, then please do ask them more about this. But the concern was, is that small robot going to be even strong enough to be able to do kind of procedures like lift the colon or lift the uterus? Well, yes, and they're sort of showing that out now in their clinical stepwise progression. So let's jump back in again at the site and just look at again a few more of the. Let's go to the Meet MIRA side of the site. Let me just interact there. Okay, so let's Meet MIRA. Okay. Oh. It's not working. There we go. Goes on to the other part of the site. My computer runs a bit slow when I'm doing this podcasting technology on it. And you might hear my wife singing in the background. She's actually doing a singing lesson today. So let me try and get you through to... I think this is quite an interesting part of the video, which I looked at, which is where they were looking at the setup speeds. So again, if you're looking at places like clinics or ASCs or places where turnover is fast, or where setup needs to be fast, where getting cranking through procedures is going to be really, really essential for somebody to be able to use a robot, then I think this is quite an interesting video. And I might not play it all, but let's have a look. So that's pretty cool. That is a pretty cool video that shows that, in under 10 minutes, actually 5 and something minutes, they go from being a room not ready to a room being ready for the robot. Now, two things that I want to note about this video, and you can go back again and look at, rewinding and look at it again. First of all, the setup is quite simple. So you have a console, you have their dedicated tower system, and then you have the actual MIRA that sort of floats over the table on the arm that's attached to the table. So there's no footprint for the MIRA, but let's be realistic here. There is a footprint of the console and there is a footprint of the tower, but that is a very small tower and a very lightweight tower. So really, the console is the thing that's the same. And if you look at this console, it's an open console, as we call it, because you don't need the 3D, so you don't need the 3D looking into it. And it's basically got an open screen that you look at, so you've got very great awareness towards the mirror. If you just look over your right shoulder, you'll be able to see the mirror as you're using it. But the thing that jumps out to me on this as well is that there's very little cabling. And I think that, again, when you're looking at real estate being an issue in things like ASCs or whatever, then cables and cabling become an absolute nightmare. So again, all companies out there developing robots, doing robots, I would sort of shout to you and say, reduce the number of cables. I mean, I hate it enough in my house when I have cables everywhere, but in the operating room, when you've got nursing staff moving around having to do their job, the less cables you have, the better. And I'm very impressed with the low amount of cables that go into the MIRA system. So here's the main components of it. So this is the robot. This is the equivalent of the bedside boom of the Da Vinci or the SP or all the arms of the Hugo. And what you've got in there, I'll see whether this will do it on my. I don't know if it will. Yeah. No, okay, I can't do that well. But there's no docking or draping. Let's see what it says on each of these little call-out buttons for you. Now this thing, it weighs 2 pounds, and that's 2.2 pounds per kilo, so it's less than a kilo for the entire robot. That's pretty impressive, and I know they're working very hard to get that weight down and get the size down as well. They're going to talk a bit about that. This I found quite interesting as well. It's steam sterilized, okay. And then what you do is you sterilize it so many times, then you send it back to the company and they just do sort of a revision of it. So you don't throw any of that away, the actual big robot. What you throw away is one or two of the small adapters and the terminal pieces right down here, which is the scissor blades or whatever. But this is a very green system, relative to a lot of the other systems. And it's a very interesting business model that, you reprocess the whole thing. You're not throwing away the instrument pieces, and there's no drapes to throw away on this either. So I think that's going to hit, very well in some places. The sterilization, obviously, they've got to get it all worked out in the back to base and all that. But again, what I'm loving a little bit about the moment with some of these companies is they're not just trying to make another Da Vinci. They're actually really trying to change the paradigm and the way that it works. And then you've got your other two components here, which is, I won't go into too much detail on this, but you've got your console, and I've had a drive of this. It's a nice console, very nice control system, and you've got your tower here, which, is, again, it's got a power unit and it's got the imaging system for the MIRA. What I found really interesting on this was, when it's hard for me to say this, you have to really get on it yourself to be able to understand this. But basically, what I found was that when I was driving it, I was expecting to have a really narrow field of view, and I was expecting to feel very claustrophobic and feel like the arms are sort of probably working like this. But they've actually done a really good job of getting the shoulders, the elbows in there, and they're not wristed instruments. So the way that I'll describe this to you is that it's a sensation of driving it that is between laparoscopy and wristed robotic instruments, because they are not wristed instruments in the sense that a Da Vinci or a Hugo is a wrist instrument or a 2MI is a wrist instrument. It's kind of a flexible elbow instrument with the end effectors on there that can rotate. So it takes a little bit of getting used to, especially when you've driven other robots. But I didn't find it as disturbing as I first thought it was going to be, which I found quite interesting. But maybe that's because I've done a lot of laparoscopy. So again, if you're a laparoscopic surgeon that's going to add this to your armament, then I don't think you're going to have a lot of problem adapting to the way that the instruments feel, work, and move. I think you'll find it quite interesting. Yep. Anywhere they took it into space, and again, if you go to their website, which I'll put the link up a little bit later, you can actually see that they did do a live surgery up to space, which was to the International Space Station, which was two things. One is very, 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 very cool from a marketing point of view. It's pretty amazing. And second, I think what it demonstrates is that that you can do telesurgery at distance. I don't think people are going to be doing, by the way, just for clarity, I don't think people are going to be doing operations in space, because you've got to get your anaesthetist up there and the entire anaesthetics machine, for one, and plus insufflators and the bed and all that. So it's not going to happen for now. But it's a good demonstration, a cool demonstration of the way that more and more of this industry is heading towards connected telesurgery. And I think anyone who's developing a system or coming up with a next generation of system, you have to have that in there. And I was really against this at the beginning, thinking, it's just a load of nonsense. But I'm actually seeing more and more use cases for it, and I just think it'll become table stakes. And if you don't have that ability to do distance surgery with it, people are going to scratch their heads at your system and wonder why it's a bit archaic. Real clinical value or not, all to be determined. That is it. That's really what I wanted to show you on the website today. Let me dip in very quickly, and I'll hand it over to. Well, I'll flip it over and I'll insert here the discussion that I had with Pete from Virtual Incision this morning. A couple of things that I'd really want to say is really nice people. I know Pete from my old days at Gynae Care, which is really nice. Very nice people. You know, John's great, and the whole team's great there. Some smart people, and I'd say they're very, very approachable. So at the end of the interview, you'll see a little bit that I asked Pete how you can get hold of them. So jump in now and have a look. Let's fire up that interview that we did earlier today. Okay, so today, very, very happy to have Pete from Virtual Incision with me today, because I'm going through all of the product, and it would be great to hear straight from Virtual Incision all the exciting stuff that's going on.
Yeah. Well, Steve, first of all, thanks so much for having us on the show. And we obviously follow very closely what you post on a practically daily basis. And we feel there's a lot of interesting nuggets in there, lots of wisdom. So thanks for having us on your show. So yeah, Virtual Incision, I think many of the people in the robotic space know it quite well by now. As you know, we had a big event at start of 2024 when we launched our space robot into orbit. It went to ISS, and then we had 6 surgeons operate from Lincoln, Nebraska, all the way to the ISS space station. So that was a big kickoff of the year. And then in February, we got our first FDA de novo marketing authorization for minimally invasive colectomy procedures.
Congrats.
Yeah, absolutely. The company's been going at it for many, many years. You know, got 2 fantastic founders, Shane Ferreter and Dr. Dmitry Oleynikov, that have been working towards miniaturization of a robotic assisted surgical system. Fantastic CEO with John Murphy that has been driving it for over 12 years now. And so now it gets real, right? Now we're commercializing. We have, of course, done our first real trade show that we can go on the floor itself. That was at SAGES. And then we had subsequent great shows at ASCRS. And we had a great honor of meeting you live at SRS, another great meeting where we were on the floor. So now we're commercial. We're going slow but steady. We don't want to go all in all at once. We want to make sure we have all the learnings right from the way we introduce our product to the market, how we train not just the surgeons, but also the staff, the SPD. As you know, our robot is reprocessed. You know, it's sterilized 15 times in the hospital after use, and then it gets sent back to our company. So all of that, we've got to make sure that runs fluidly before we scale up. So that's our first access program. We have two robots installed now, one in Bryan Health with Dr. Mike Jobs, that's in Lincoln, Nebraska. It was also the surgeon that did 15 of the 30 cases in our study. That study also got published this year in diseases of colon and rectum. And then we just this week installed a system at Hoag in Southern California, where Dr. Raskin will be one of our, we call them VIP surgeons, the Virtual Incision pioneer surgeons. And we're looking to place 3-4 more systems by the end of this year, and then about 4-5 in 2025. In the meantime, of course, we only have an indication at this point for colectomy, but we're going on all cylinders to get the next indications through. I'm actually calling you here from Geneva, where Dr. Debuisson at the University Hospital of Geneva has done the first hysterectomy a couple of weeks ago. And I'm here because he's doing 2 more hysterectomies tomorrow. We trained another surgeon yesterday that will be part of the clinical trial here in Geneva. And we're expanding that clinical trial to the US. So we will have Dr. Estape in Mercy, Miami join, and Dr. Gomez at the University of Las Vegas, and probably a 3rd US site. So we're working through all the motions, getting the IDE approved by the FDA, of course, once we expand that clinical trial to the US. So that is a lot of work. And we hope to have that indication by the end of 2025. And we're very hopeful that we'll be able to do that. It's a fantastic, as you know, I'm a gynecologist. It's a fantastic hysterectomy tool. It's really made for it. It's such a quick setup. It's so easy to go around. You just use the bipolar grasper that we have to do most of the hemostasis. So going really well. And in parallel, our R&D team is not sitting still because we will have a smaller version of our robot with a smaller diameter, 2-centimeter incision instead of the 3-4 centimeters that we have today for colectomies. And so that too should go through verification and validation, all those good things that are necessary from an R&D perspective to have that on the market by the end of next year too.
Wow. And besides that, not a lot then. Not a lot going on. Huge amount. Amazing.
Nothing going on. Oh, hey, I'll tell you one more fun thing, and then I'll hand it back to you because I feel like I'm doing a bit of a monologue here. 2-3 weeks ago, we had a great collaboration. We have a great collaboration with a company called Sovato. I don't know if you know them.
Yes.
That is run by Yulan Wang, and they're looking into commercializing remote surgery. And of course, we at Virtual Incision believe that simplifying the patient end of the robotics will help in remote surgery, because if you have to bring a complex system like a fantastic Da Vinci over to another side and the whole team and everything that goes with it, you may as well just send the surgeon with that program as well. So we've been working hard with them, and what we did is we had remote surgery. It was a porcine, protocol on a porcine model on a protocol where they operated from Santa Barbara, the headquarters of Sovato. We had 4 surgeons there, 3 from the city of 1 from UIC, University of Illinois in Chicago, and they operated at UIC. So that was a 2,100-mile surgery. We did 5 pigs, 20 procedures, 4 surgeons. We did hysterectomies, colectomies, cholecystectomies, and nephrectomies. So phenomenal experience.
Wow.
I was on the pig side. So Dr. Dennis Fowler, he's a legend in the world of minimally invasive surgery and in the space of robotics also, of course, with his past history. We were the first assists at the bedside of the pig, and we had a great time just going through all these procedures, one after the other, flawlessly. It was crazy. I forgot to mention we did gastrectomy, partial gastrectomies. Dr. Wu from City of Hope did those.
Wow.
Lots of fun.
Wow, busy. That's amazing. Look, a lot of people ask me questions and then they say, virtual incision. And some people know it, some people don't know it. But one of the questions that often comes to me is, hospitals got a Da Vinci. Why would they need a second robot, or why would they need something like virtual incision? So, if you got asked that question, and I'll ask it direct, why would somebody need a virtual incision if they've already got, say, a Da Vinci in the hospital?
Listen, I think we've always claimed that we don't want to compete with a fantastic product like Da Vinci, right? They've got everything. They've got all the bells and whistles. They got 30 years of R&D under the belts. They've got a fantastic commercial team. So that is a flawless model and one of the best medical devices. You and I have both been in medical industry for a long time now. This one is a prime example of what good looks like. Okay? Now, if you look at robotics, and let's just focus on the US for a second, I think the penetration of robotic systems is still somewhere between 5 to 10% across procedures and across hospitals, ORs. When you speak to the younger surgeons, all of them want to do robotics. I think once you've been on a robotic system, you feel that it is just better. You can be more precise, it's more controlled. And if not for the patient, even for the surgeon, the ergonomics of having to go hang over large patients or difficult long cases, it just intuitively better. They picked a good name for their company.
Very good name. Very good name.
It is unlikely that every operating room needs a big system like Da Vinci. Not all procedures are that complex that they would need all the expensive tools on there. And the setup time, let's be honest, of a Da Vinci is not that quick. Ours is, a fairly short setup time, somewhere between 5 to 10 minutes, really. One person can do it with the surgeon. It's very versatile. For your bread and butter procedures, you can do it. But I think what we've shown in the colectomy trial is that it's not a mini robot for small procedures. You can do multi-quadrant procedures, complex procedures. So again, I think it's complementary. I think physicians can use their intuitive for, the higher complexity, the high reimbursing cases. They can do Da Vinci on the side. They can flip between rooms. They may have certain specialties that are less reimbursing, but equally benefit from a robot. I'm thinking about gynecology, for example, where the turnover and the number of cases per day is much higher than, for example, in colectomy. Smaller robot, quick, efficient turnover time seems like a great proposal to me.
Yeah, no, and I think you're right. I think the days have gone where people just see it as one market with one type of robot, and I think there'll be tools for different types of cases, as you say, different locations. And there's a lot of locations I've seen around Europe and in the US where you physically couldn't get a Da Vinci in there. And I think what was one of the most impressive things for me about your system was a the dimensions of it is the whole robot is contained in a really small package that sort of just sits above the patient, which I found really, really interesting. That is zero footprint on the floor, really is zero footprint on the floor. My concern about it before I went on the demo with it was, how could those little arms be strong enough? And I was amazed. I mean, I was literally amazed by the strength in the arms, the engineering that's in that. Compliments to your engineering team, because that's a phenomenal way that you've done that. So I'm really excited by it. I thought it was really, really, really good.
The strength amazes everybody, Steve, and I think that's also why we don't want to be pigeonholed in the SP class, because I think we're very different from SP. Yes. Of course, our motors are inside the arms, driven by directly driven micro motors made by Maxon, as one of the best motor companies in the world, and you can lift heavy uteruses, because we're now doing uteruses or a big colon, diverticulitis colon, you can move that no problem whatsoever. And I also think that our triangulation is different than what you would see in SP, because we can really, pull those arms, the amount of workspace that we create with those arms. If you would look at where you would have to put your trocars, where we can come with our arms, it's mind-boggling. It just blows everybody's mind once they start to realize what you can do. You can operate completely backwards with your arms completely backwards. The articulating camera just follows you, and it's right in front of you. It's like operating, without doing any acrobatics. It's great.
It was amazing. And again, like most of these systems, until you get on it and try it, you can't really understand it. So to finish up, if people want to get hold of you guys, if they want to get on the system, see the system, what's the best way for them to do that?
So reach out. We've got a website, and I'm sure you can find us there. They can also reach out to me or John Murphy or Crystal Simons or Chris O'Hara. I think we're very open to have people. We have labs going on, Steve, on a weekly basis. We train 1 to 2 surgeons by means of introducing it, right? Because as I said, our commercialization model is tight, and we want to be very conscious about how we introduce it. But we train surgeons continually. We've got a fantastic headquarters in Lincoln, Nebraska. That is literally the middle of the United States. If you draw a diagonal across the US, it's right there, even though people in Kansas City would argue with me. But yeah, we have a mock OR. We have our own animal facility. It's a collaboration with the University of Lincoln. We would love to have people over if they're interested. Absolutely.
Perfect. Well, look, I know you're really, really busy and you're over there in Europe at the minute, being extremely busy there.
Yeah.
So thank you very much for your time today. And if anyone wants to reach out, I'll put the website up on this post so that people can reach out to you directly. And thank you very much again for your time.
Thanks, Steve. Thank you. And good luck with your show. And I hope to see you soon at one of these conferences.
See you then. Bye-bye.
Bye-bye.
Well, I hope you found that interesting. And again, thanks to Piet for taking the time this morning, my time to do that. I know he was incredibly busy, and they've been very busy doing a lot of stuff on the gynecological side of things, which I'm looking forward to see the data that's coming out of that. And again, what I would say is, go in with an open mind when you look at these systems. And I think that the entire community needs to start looking in a way where there's not going to be just one solution for everything. I think there's going to be multiple solutions out there and multiple ways that we use robots for different locations, with different surgeons for different surgeries. And I think that this is one of the very interesting ways that a company has approached it. So congratulations to John, the entire team, and everyone at Virtual Incision. And I hope you found this useful today. And if you want to go deeper again, go to virtualincision.com. You can find out more information that's over there and go deeper into it. And again, you heard Piet say, if you really want to get on this and try this, they're doing lots and lots of labs. So jump in on a lab, have a go with it. Doesn't mean that you'll get it commercially, because they are being smart and wise and not trying to go commercial everywhere all at once, which is the sensible way that companies do this nowadays. And yeah, I'd like any feedback in the comments on the video, or any questions and suggestions of other platforms that you'd like me to cover. And I hope that that's given you some insights into MIRA from Virtual Incision. Talk to you next time on the MedTech Mavericks podcast.